If 20% of our nation's children suffered from leukemia, there'd be a public outcry and a rallying of resources. Yet, 20%, 1 in 5, will need support for mental, emotional, or behavioral issues. Unfortunately, very few resources exist to help children suffering from mental illness. Clarity Child Guidance Center exists to help children and create the next generation of leaders. We're one of only a few precious resources in the country specializing in children's mental health treatment. We want to reduce the stigma associated with children's mental illness. This creates the opportunity for conversations that end the silence families are currently experiencing. Secondly, we're increasing access to outpatient therapy by opening clinics in areas of high need. The average wait to see a psychiatrist for an appointment is months. Would we allow a child with a broken arm to wait that long for care? We're committed to changing that wait time. Finally, across our great nation, there's a shortage of psychiatric beds for children who are most at risk. Our community alone needs 60 more beds. As a result, we're expanding our campus to include additional beds for children at acute risk of harm to self or others. Our success starts with our staff, who embraces our innovative model of care. We believe that children do well when they can. This allows us to work collaboratively to solve problems while creating coping and communication approaches for the entire family. This results in 9 out of 10 parents sharing that their child has improved as a result of treatment, with the majority stating that the improvement was significant. Our organization is effective because we take the time to collaborate with the entire family to find solutions. We ensure that we have the appropriate staff-to-patient ratios, allowing us to create trusting partnerships with children and families. Our kids have access to individual attention and high-quality care provided by our nurses, psychiatrists, psychologists, and counselors. Incorporating the family into treatment is the key to success. As a nonprofit that has achieved Joint Commission accreditation as both a hospital and behavioral health center, we monitor myriad key performance indicators. The most important metrics relate to treatment outcomes, quality of service, and feedback from families themselves. Most people aren't aware that we're also a teaching hospital affiliated with the University of Texas Health Science Center at San Antonio. We're actively training future doctors who will innovate the model of care even further. Additionally, our campus serves as a retreat for children. Our 6-acre campus features a swimming pool, multiple playgrounds, and the integration of art and music into the daily schedule. An on-site school is also available. Basically, all the elements of childhood joy are here. While the public isn't talking about mental health, medical professionals are, due to the nationwide crisis in clinics and emergency rooms. Clarity Child Guidance Center's reputation in the medical community is solid. 3 out of 4 local professionals would refer a child in crisis to us. We maintain high loyalty rates with parents and caregivers who work side by side with us as their child receives treatment. The stigma of children's mental illness is pervasive. It leads families to feel as if they're the only ones experiencing an illness, and many wait too long for treatment. Stigma leads to fewer people advocating on behalf of this serious community need, resulting in less funding, support, and attention to a growing epidemic. In our nation, we lack providers, access to outpatient or acute care, and funding. Clarity Child Guidance Center will remain on the leading edge of what mental health treatment can be in our nation. We envision a future where millions will have taken the pledge at oneinfiveminds.org to end the stigma. We would talk openly about our children, not just their physical health, but their mental health as well. As a result, we would serve more children, providing preventive care through rapid access at clinics throughout the community. Each clinic could serve hundreds of children annually, addressing their needs with outpatient therapy. These clinics would be located in neighborhoods where people live, work, and play. There are levels of treatment not available in our community. For example, we could provide respite care for parents and caregivers struggling with a mentally ill child, or services like an early childhood center to prevent the onset of symptoms or mitigate illness, or even an after-school care program. Also, we could expand knowledge and treatment through the use of technology, whether taking our continuing education sessions that are free to the community to a virtual approach, or exploring telepsychiatry to bring families living in rural areas the care that is so desperately needed.